Hi, my name is Nurse Danny, and today I will be performing a physical assessment on Mr. Shiba. Mr. Shiba's Snellen chart has been tested before this. He's able to read all the lines on 20/20, and he cannot read the lines below that. His vital signs are at 98 degrees Fahrenheit. His pulse is at 70 beats per minute. His respirations is at 20 breaths per minute. His blood pressure is at 120/80, right arm seated. His pulse ox is at 98 degrees, right index finger. And now all my equipment has been sanitized before this assessment. And now we're going to go talk to Mr. Shiba. Knock, knock. Good morning, Mr. Shiba. My name is Nurse Danny. Today I'll be your nurse. Could I have you verify your name and date of birth for me, please? December 23rd, Mr. Shiba, 1993. All right. Thank you, Mr. Shiba. I'm going to ask you a series of questions before we begin the assessment. Are you allergic to anything today? Are you allergic to anything like your environment, food, plastic, medication? No? Perfect. Do you know where you are today? You're at West Coast University Hospital. Do you know why you're here today? You're here for a physical assessment. Do you know what time it is? 9 a.m. And do you know who your current United States President is? President Donald Trump? Perfect. Now I'll ask you a few more questions before we begin. How is your mood today? It's good? Okay. Are you like that every day? Perfect. Are you in any pain right now? No pain? And are you taking any medications right now that I should be aware of? No medications? And how about your bowels? How often are you moving your bowels? 2 to 3 times a day? Can you describe your stool for me? It's brown and consistent? Perfect. Do you have any constipation? No. How's your urine? Can you describe that to me? It's yellow, there's no smell? Perfect. Do you have any pain or burning on urination? No? Okay, perfect. Now we will begin your assessment. Do I have consent to touch you? Perfect. Thank you. Now we're going to check your lymph nodes first, all right, Mr. Shiba? We're going to check your pre-auricular lymph node, post-auricular, now occipital, retropharyngeal, submaxillary, and submental. And then I'll check your supraclavicular for the lymph nodes here as well. Perfect. Now I will inspect your ears. First, I'll check your ear. There's no drainage, no swelling. It's pink and there's minimal ceramin. Same over here. No drainage, no swelling. It's pink and there's minimal ceramin. Now I want you to follow my finger, or I'll check for your accommodation first. So pupils constrict. Now I want you to follow my 6 cardinal gazes that I will be pointing to. Follow my finger. Perfect. Now follow my finger as I bring it in. Perfect. Now check your nose real quick. No obstructions. Now I'm gonna have you smell this a few smells for me real quick. I have lemon right here. I'm gonna have you close your left nair. Take a sniff. He smells a lemon. Close your right nair. You can smell the lemon. Now I have spearmint eucalyptus. Close your left nair for me, please. You can smell it. You smell it. Perfect. Now I'm gonna do a whisper test behind you. All right. Now I'm gonna have you close your left ear for me and repeat after me when I say something. Apple. You can repeat after me. Apple. Close your right ear for me, please. Repeat after me as I say whatever I say. Apple. Apple. Perfect. Now, I'm going to inspect your mouth. I have my tongue depressor right here, my flashlight. And can I have you stick your tongue out for me? Stick it up. The frenulum is midline. Perfect. And you stick your tongue out again. I'm going to depress your tongue and say, ah, ah. He has grade 1 tonsils. I can see it. His oral mucosa is pink, no cuts. His teeth is all white. Everything is normal. Can I have you stick your tongue out for me? Stick your tongue up, left, right, down. Please, thank you. Wash my hands. Can I have you shrug your shoulders for me, please? Perfect. I want you to demonstrate. Follow me and demonstrate what I do. Touch your shoulders like this. Touch your shoulders back like this. Stick your arms out like this. And put your hands up. Your range of motions are okay. Now I will check your arms for warmth. His arm is warm to the touch. Check for bony prominences. For edema. No edema. Check for his pulse. +2 is normal. Now I'm going to check your cap refills on each nail bed. Every time I release my press, it is less than 3 seconds, which is normal. Now we are going to check for your reflexes. Checking for your tricep tendon with the pointy end. Now on the other side. Now we're going to check for your bicep reflex. Same over here. Now can I have you put your hands over your lap, follow my rapid movement, and just follow along, okay? Perfect. Now can you have you push down on me, push up on me, push against me, and pull against me. Perfect. Now I'm going to start listening, checking for your carotid arteries. Can I have you turn your head to the left at a 45-degree angle? And I'll check for the jugular vein distension. No jugular vein distension. Now turn your head to the right for me to check for jugular vein distension. No jugular vein distension. We're going to palpate at one at a time because the patient can faint. Now same over on the right side. And then we'll listen to his carotid arteries for breathing. We're going to use the bell. No brewery. Take a deep breath and hold it for me. No brewery. Take a deep breath and hold it for me. No brewery. Now I will listen to your breath sounds, okay? Move. I'll listen to it using the diaphragm. Now take a deep breath as I move my stethoscope. Perfect. There is no adventitious sounds. It's all breath sounds are clear. Now I want to check for your skin turgor under your clavicle. Perfect. Now I want to check for your heart sounds. To your right, second intercostal is your aortic valve. Your S2 is louder than S1. Second intercostal left side, pulmonic valve. S2 is louder than S1. Third intercostal left side, Erb's point. S1 and S2 is equal. Fourth intercostal left side is the tricuspid valve. S1 is louder than S2. Fifth intercostal left side mid-clavicular line. S1 is louder than S2. Listen to it for 60 seconds. I hear 70 beats per minute. Now I'll check for your respiratory expansion. Go to the costal margin. Can I have you take a deep inhale for me? That's symmetrical expansion. Go into the 10th T10. And now can I have you take a deep breath for me? Thank you. It's symmetrical. Now we're gonna go down to your abdomen where sanitize my equipment. And now I want to inspect your stomach. Your stomach is flat. There's no umbilicus is midline. There's no pulsation, no cuts, no masses. And now we're going to auscultate. Starting from the right lower quadrant, I hear 16 to 20 gurgles. 16 to 20 gurgles. 16 to 20 gurgles. 16 to 20 gurgles. And now I'll flip over to the bell. So I listen to abdominal aorta. No bruit. Down below the umbilicus to the left. No bruit. Now we're going to percuss the patient from the right lower quadrant. Tympani. Now we're going to palpate. Tell me if you have any pain as I palpate. No pain? Perfect. Now we're going down to your legs. I want to check for warmth to the touch. The skin is warm to the touch. Checking bony prominences for edema. No edema. Now check for the cap refills on each toe, each nail bed on the toes. As I depress, let go. Less than 3 seconds each, which is normal. Now wash my hands. I'll check for the popliteal pulse right below, behind the knee. Check it together simultaneously. Is normal. Now we're going down to the dorsalis pedis, which is between the great toe and the ankle. They're normal. Now I want you to push your feet up, push down, push against me, and pull against me. Perfect. Now I need you to do the rump. No, I'm going to check under your feet first. Feet is normal. Skin is normal, no cuts. Now can I have you demonstrate this following after me using your heel to your shin. Rub like this. Alright, perfect. Do the same over here. Perfect. Now can I have you put your hand off to the side, close your eyes, stand there for 30 seconds. There's no sway. Perfect. And then demonstrate this for me. We're walking from your heel to your shin to your heel, like this. Check for your gait. You have a steady gait. Perfect. And that is the end of the physical assessment of Mr. Shiba.